Hello, everyone. Welcome, welcome. We're going to give it a couple of seconds for everyone to trickle. All right, everyone. So as people continue to trickle in, welcome to our lovely session with our amazing panelists. I'm so excited for this session. We're just going to get started by introducing ourselves. My name is Sebla. I am a graduate student at Harvard, and I will be introducing our wonderful panelist. Quatia Osorio is a Rhode Island native born and raised. Bryant University graduate, certified perinatal community health worker, certified lactation counselor, community outreach perinatal educator, birth and postpartum doula. She is the founder of Our Journey, a perinatal community-led and based center focusing on eliminating health determinants of communities of color through maternal support, education, advocacy, and awareness. Her organization works to expand and increase the doula workforce through doula training, professional development, and legislative policy for doula care and access. The first facilitator of the Chocolate Milk Cafe Rhode Island. Chocolate Milk Cafe International Board of Lactation Consultants Examiners approved breastfeeding peer support group to help encourage, support, and educate Black, African American, and Afro-Caribbean families. Additionally, she oversees the other 3 chocolate milk cafes in Rhode Island. Doula businesses focused on advancing better maternal health outcomes and promotion.
Is that just my internet?
No, mine, she stopped on mine too.
Maternal health, change makers, training, and networking. A former City Match City leader and presenter, former Birth Equity Leadership Academy mentee with Health Connect One, and a member of the National Perinatal Task Force, recently joining the National Black Midwives Alliance to learn how to engage with the midwifery model of care and build deeper cohesive relationships with doula partnerships. So we want to welcome Quatia, and we're so excited for your presentation. Thank you so much for
having me. Hi, everyone. So excited, so happy to be here. I look forward. Thank you for having me on this panel. I want to give a shout out to Ndidi for even selecting me and the fabulous team over at Mother Lab. Shout out to my collective who's on the call and everyone who's joining. What you may not notice, but you will in the presentation, is that all 3 of my doula trainers are actually in this conference. So Chanel from Ancient Song was my first trainer, followed by Shafia Monroe, who's my second trainer, and then Jenny Joseph, who concurrently, if you're attending mine, unfortunately, you cannot attend hers. And that is the final organization in which I certified with. So definitely looking forward and happy to be here. And I hope you enjoy my presentation. So my present workshop is stated on our community, our heart, and our pain. Shout out to NTD, I see you. Next slide. Here's my bio. I know we get lost in like the acronyms, or as they call the alphabet soup at the end of our name. So BSBA, Bachelor of Science in Business Administration, CCHW, Certified Community Health Worker, CLC, Certified Lactation Counselor, MCHS, Maternal Child Health Specialist, CPE, Certified Perinatal Educator, and MCHW, Certified Community Health Worker and Doula. Of course, you guys knew that one. They went over my bio, so we could skip all that. I'm just plain old Q. Next slide. So this workshop is going to focus on connection, community, and compromise, the importance of doulas as connectors, and our position in the maternal child health movement, beginning a doula practice with community engagement and relationships, understanding system design, guidance on building connection, self-care management, and trauma within the work, and a strong emphasis on community-centered led doula practices. Again, since I am trained through some of the organizations that are presenting here, you'll see that there's a continued focus in the way in which they've trained us and taught us, and how we carry that even into our work now. Next slide. I want to take time to honor our ancestor, Grand Elder Midwife Mama Claudia Booker, whose path began for midwifery as a doula. If any of you had any opportunity to be graced in her presence, you were just blessed, like so blessed in so many ways. And if you listen to her story, you learn just how she came about this pathway. So how you answer your call to this work and how you respond in the process is yours. Sometimes it's an eternal struggle, sometimes it's a series of events, and sometimes you are simply answering the call. You may start off with good intention or drive to make impact, and just know this work isn't about you, but those you choose to serve. You just happen to become a better person because of it. And that's just something that I learned through Mama Claudia. Is she was very tenacious, and her authenticity and just being genuine, and how she approached this work and what it meant. And I just felt like it just answered and confirmed and affirmed so many things that I questioned internally in my struggle on being a doula, and then moving forward with choosing to become a midwife. And so it's always nice when, you know, the divine, the universe, God, Yah, whoever you call your being of soup, that just kind of like answers to you. I feel like he placed her in my life to affirm me and to encourage me to go. And so now that she's on our ancestral plane, I feel even more guided to continue this work. So just give an honor to her. Next slide. So planning your path. Much of this work is also very business oriented. It's great you want to become a doula, but you need to plan your pathway. So a thing to know, it never stops, right? Like our professional education, for those of us who are doulas, those who are interested in becoming doula, just know you're never going to stop the planning. You're never going to stop learning, getting educated, and just building your platform, right? So it's a consistent process within establishing your own doula practice. Should you become an organization, a collective, and or an agency, iteration is necessary component to review your planning, success, outcomes, and reaffirm that you are aligned within your mission and vision. Write down your vision, your mission, your strategic plan, and necessary steps to reach these goals. And I say that because every time you reach a certain pinnacle in your learning, you want to go back and make sure that you don't get deterred. You don't get distracted from external forces. You don't deviate for why you became a doula because you just get so caught up in this. And I know some of the speakers spoke to this before about just staying true to why did you become a doula. Next slide, please. Choosing your certifying trainer. So this is me. This is my path in 2015. You see, there I am, very young, a little skinny, with Chanela Ancient Song Doula Services. And then in 2018, my organization hosted with the Shafia Moreau Consulting, along with a partner who's now part of my collective, Amutah-Onukagha Doula Collective. And then we finally completed our last training. There's Mama Ak Mary, or Auntie Ak Mary, like she prefers to be called, in our final training in which I finally became certified within the organization. So as you heard Mama Elder Midwife Shafia speak about certifying, that is just kind of finding that organization that really fits you and builds upon you. And I was intentional on being part of a Black woman owned and led based building organization. So all three of my trainers were these dynamic women who are now in this conference. So I feel like I really came full circle in this work. Next slide, please. So designing your practice, right? Are you going to be a solo practitioner? Are you going to go in partnership with someone? Are you going to become a part of a collective, a cooperative, an agency? So these are things you need to think about. It's not just, I want to become a doula, but what does that look like? How are you going to frame your practice? How are you going to take your practice and integrate it into the community and really build upon that work and make deep, meaningful impact in what you're doing? Next slide, please. So this is just explaining the difference, right? Solo proprietor. So that's going to be like your tax identity. You know, you're going to be a sole prop. So you practice by yourself. You have to design your own brand, your mission, build your clientele, determine your capacity for practice. One thing that Chanel pointed out in hers, if you attended that one, is you can only take so many clients a month. And what does that look like, right? You cap out very quickly due to your availability. Finding backup. So again, you have to build relationships, network. Who in your community is backup for you if an emergency happens, whether you have children, family, life, work, your job. If you're going to teach classes or programs, right? That kind of limits your rotation and your ability to be on call. In a partnership, there's a little bit of that like breath of fresh air where you're like, okay, if I don't do this, my partner will do this. And so that's always great. Co-ownership, right? So you have shared costs and resources in teaching. So you go either 50-50, split 3 ways, a quarter, however you're doing it. You can do it in shifts, rotating schedules, teaching classes on a different basis. What are the cons of that? No single ownership of your materials. If you choose to move out on your own, there might be some issues. You might have to dissolve your partnership legally, and there may be complications if it ended in like, you know, bad blood and bad relationships. So things to kind of think about when you are starting to form your practice or build upon your practice. Next slide, please. A collective or a cooperative. Diversification and equal distribution of ownership. So a collective can be member-driven, an associated collectivism, or a cooperative work group. Practicing with multiple supports, designing a collective brand, sharing resources, more client capacity, able to shift and swap out, teach more classes together, really building and diversifying, right? So when we talk about Black Wall Street or liberation in economics, and like, so collectives and cooperatives is really the framework in which that is built. You never have to find your own backup. Confirming availability. So for me and my collective that I'm a part of, we have a shared calendar, and it pops up across all of our calendars using Google Calendar and shows who's on call. So if you're in a situation where you're like, oh, you know, I might need a doula, I might need a backup, it's right on your phone. You know who's available and who's not available because they might be on call at the same time as you. Agencies, they could be owner agencies, government, or social services. So this is where we kind of see something like Healthy Start programs. You know, they may have an agency. Someone may have decided that, you know, we went from a solo practice, we built a partnership, and now we want to like build an agency. We really want to build that base up, right? So when you're representing your agency, not your own collective brand. There might be differences in practicing philosophy and operations, right? Because this agency, while doing this work, there's still this return of investment and this financial mindset that you have to have as an agency owner, or as the agency that you're participating in has to keep mindful, right? Like you still need to get paid at the end of the day. Dissolution of agency or client relationship. So you can't go into an agency and be sliding people your own personal business cards like that. You just no, you can't do that. That can complicate things. You don't want to end up blacklisted, especially if that agency has really good future connects that can kind of build you up. Be really transparent and communicating and how that works. Like, I think that I want to come out on my own. Do you mind if, you know, this client that I worked with, I got from your agency, but she's pregnant the second time around, or them pregnant second time around, you know, they want to stick with me. I don't want there to be any issues with that. How do you feel about that, right? But the good thing of an agency is the consistency, consistent support. You don't have to go and find your clients. The agency finds the clients for you. You have a consistency in being paid, and you don't have to do none of the billing. And then most of the agencies, they build in these larger pools to have trainings, BLS, CPR, AED, and NPR for the staff. And then again, opportunities to network with future stakeholders, building community, sisterhood, and stability. So these are things to think about as you're deciding to not only just become a doula, train, but what will it look like when the training's all done? How do you want to start your first steps? And even if you are now a solo or a partnership, can that potentially evolve? Next slide, please. So connections, relationships, imposters, and alliances. So one, you want to build off your existing base, right? Start where you are and build out from there. No one's expecting you to finish your training, start working on all the certifications, because we know most of us have to build, like, it takes about 2 years to finish the certification. Breastfeeding audits, childbirth classes, attending the births, marketing, building up our financials so that we can get that equipment that, again, you may need technology, right? So you want to just start off small. I remember when after I was done training in New York, I had to come back to Rhode Island. And while I had Chanel, I was all the way here, so I had to start off where I came from, right? In that case, as you're building out, be intentional about your relationship, right? Take your time with your answers. A lot of time we have to invoke some of the things that we teach to our clients, like brain, what are the benefits? What are the risks? Think about those same things and how they apply to you, and always consider your reciprocity. So one of the things that was brought up in the conference is building off of and giving support to those other organizations. So referring back to those other organizations. So I could say, Ancient Song Doula Services, Mama Shafia's Institute, her consultant organization, Uzazi Village, in which I became a chocolate milk facilitator. So always giving back, always finding a way to build back and refer back to those resources, because you want to keep that reciprocity going. They have, imparted into you, and you want to in return impart back into them. And that's really how we continue to build, especially within the Black community. Be authentic and open to learn. So real recognizes real, right? Eventually the truth is going to come out. And I say that in any relationship, give people time to learn who you are, and you time to learn who they are. Because it may seem like, everything is glittery and gold, and then it might be fool's gold. Or it just may take some chipping away at what we think is like rough edges and rocks to really get to that gem on the inside. So take your time and build these relationships. Be intentional. Say, I don't really know what I want from this relationship, but I know I want to work with you. And in time, I hope I could figure that out. And allow someone to say yes or no, and be okay and respect that response. Be careful where and who you share your intellectual property and knowledge. We get into this a lot about, what belongs to who, what language, what words, how you build your base. Again, just realize you don't want to throw out gold. You don't want to throw away your gems because you was expecting gold. There's still value in diamonds. And so be careful who you share your information with, but just understand whatever you were thinking, someone's probably already done it somewhere else. You may or may not have heard about it. And so don't be so quick to trademark everything that you do, or, say that's mine if you happen to be part of a larger group or forum and you see something that you were designing happening at the same time somewhere else. I always say great minds think alike. If they're doing something that I had on a notebook written somewhere on a pad, building towards my future, and I didn't get to it yet, and I see someone doing it, I'm applauding that. I'm supporting, sis. I'm doing the same thing, sis. I'm so great to see that you're doing that too. And so just kind of not always feeling as though things are happening to you. And be strategic in your alliances, right? Remember to go back to that planning. You want to align your mission and vision along with who you're bringing into partnership, or who you're aligning yourself with. Like they say, not all kinfolk, not all skinfolk is kinfolk, but at the same time, you don't want to put your allegiances to something that can be divisive in your community later on. And now you have to come and apologize because you didn't do your due diligence. So just be a good community leader and partner, and role model what you want others to do to you. Next slide, please. Be willing to pivot. I mean, the biggest thing about this work is you really don't know where you're going to end up. So you need to learn to adapt to the needs of the community. So when I began our journey, it kind of started out as a solo practice. And then in 2016, I ended up with this phenomenal partner who was building out her own base. And she's a baby wearing educator and leader in the community. And, we just started running together and built this really great partnership that was genuine and authentic about elevating each other. And then from there, realized hey, it can't just be me and her. There has to be other people. And that began the formation of the Mojinia Doula Collective, which, these are women who we train together, we laugh together, we build together. And now look, we have an entire collective, right? And that's just in the doula framework. The goal is eventually to like build out that base so that we have a full wraparound maternal care system. And so that means, all right, next level, some of these doulas right now are working to become midwives, me, myself, working to become a midwife, and just really building on where everyone is. Not everyone's going to be a midwife, but you're still going to need all that support from the team. So just always checking in, like, are they comfortable where they are? Is there anything that you can build into them and help them to support? Next slide, please. Get mentored. Oh my gosh, look at my mentors. Like, so blessed, so honored, so humbled. Our paths have been paid for us to thread easier than ever before, right? Like, give honor, appreciation to those who've done so much of the work before we came along. And the wisdom of others is invaluable along the way. So if you're on this call and people are saying like, call me, get in touch, take that number down, take that email, call them. You have no clue like where it will bring you. I never would have thought, like, you know, being in Brooklyn, New York, over there by Marcus Garvey, that I would now be in Rhode Island doing the things that I'm doing and where it has truly brought me. And so I'm just honored and humbled. And pick up the phone, call them, cheer them on if they're going to an event, you know, give them a shout out whenever you can, and continue to just really learn and sit with it, right? Because we don't have to go as hard as we ever thought we did. You can go a lot easier if you just kind of check in and see what's already been done and who is willing to like help you along the way. Next slide, please. Collaborations, right? So we're going back to our planning and vision. You know, you want to take a deeper look. So this logo is my chocolate milk logo that was designed when I first went to Uzazi Village and became a facilitator. And now we have a national chocolate milk. And so I went from, you know, a kind of side chapter and, you know, coming out of Uzazi, and now here it is being part of this national chapter, right? And so planning and building a vision, and you want to build your collaborations with others who are already doing the work. Like, where can you fit in? Where can you lift up somebody else's work? I always give a shout out that, you know, chocolate milk does not belong to me. Chocolate Rhode Island, you know, is dope. We dope, but we come from, you know, good stock in the case where, right, like this was already laid before us, this framework. We just had to build upon it here. Like you said, looking at our community and seeing, well, how does this look to build this in our community and being community responsive? Chocolate milk was asked for from the community. What was a way that we could address, you know, low duration of breastfeeding, right? And it just so happened we had a breastfeeding conference and Mama Hakima came and she was like, this is the things that I'm doing. And I was like, can we do that? Can I go and create a chapter here? And she said, yeah. And I put it out, you know, in a GoFundMe. Shout out to GoFundMe's, because your community will support you if you put out the ask. And they funded it. And I was on a plane flying in July to Zazi and learning and becoming a facilitator, right? And you always want to give credit back to where you came from and build it. Like, while I'm building my own signature, like this logo was designed, if any of you are on Instagram, GDB is the artist. Plenty of her artwork is in my office. I support this dope Black artist. And I commissioned and she designed this logo for me. So again, referring back to your trainings, other organizations and partners, it's not always necessary to create your own. That whole crab in the barrel mentality, it doesn't elevate us. And so for one thing here, people are always asking, are you going to do another doula training? You know, are you going to teach a doula training? I don't need to teach. We have great trainers. I would rather fly someone in who has all their T's crossed, all their I's, fly them in, do my end of building it and let them train and the excellence in which they're able to develop this. I don't need to do a training. I can simply support training organizations, and that's fine by me. Let's work on me. Let me do what I'm really good at doing. Next slide, please. Seek to build beyond. So this happens to be one of our directors here at one of our community-based hospitals on an equity health initiative, right? So local community, Journey, City of Providence, Mount Hope Community Center, which also happens to be our fiscal agent, in the John Hope Center. And then statewide, you know, Doulas of Rhode Island Department of Health, Sister Fire, which shout out to our dope community organizing organization here in Rhode Island, led by Dietra and Shin Ravi, the Homogenea Doula Collective, right? We go statewide. Lifespan Women and Infants Hospital. So when we talk about building, again, that planning and that vision, as you go along, you want to keep going back to it and say, well, where are we going to go next? Where are we going to know next? Do we want to tighten it up? You don't need to be in every lane in the highway of this maternal child health journey. If your lane is just doulas, then just stay in your lane. You don't have to do lactation. You don't have to do childbirth education, but you can integrate and work with the people who are already doing that. And now, national level, National Perinatal Task Force, shout out to all my perinatal safe spots. City Match, never would have thought I would have been on a national platform with them. The National Black Midwives Alliance. I don't know if you've been attending their presentations, but they're dope and you can learn so much even as a doula. And then the Maternal Child Health Network cohort, which I ended up applying for and getting into. Why? Because policy, it influences and guides what we do. Next slide, please. Liberation, longevity, and self and collective care. Let me tell you, keep first things first. Family needs to come first. Don't go trying to save everybody out there in the community. You can keep your cape at home and save your home. Therapy and joy, right? Emotional health is integral to our well-being. And I'm a big supporter of the NAP ministry, right? We find liberation and rest. And so my family is here. This is the matriarch of my family, my grandmother. I do breakfast with her every Thursday. We hang out. She is so cool and dope. And I'm still scared of her, right? Like, you can't play with these matriarchs. Farming is what I do for therapy. I am a USDA registered Black urban farmer. I do plan on bringing nutrition into the work that I'm building. However, at this time, I'm in my own learning journey. So I can't teach someone and learn at the same time. So I'm trying to just learn what I have and then bring them along in the journey. You know, part of that teaching is making space for other people to learn alongside you. And I rest. Sometimes you call me, and if my calendar says I'm taking a nap, well, I'm busy. I'll get back to you when I get back to you. I don't need to be on 100 every day, every single day. And then when it comes to collective care, again, checking in with your family, whether that's your doula family, your midwife family, your community family, making sure that they're finding joy in the work that they're doing, and also making sure that they are resting. And so one of the big proponents of the National Perinatal Task Force is that we have this collective care model where we check in every month and just make sure that we're taking opportunities to rest in the work that we're doing so that we are safe, so we could do this long term. Next slide, please. Envision your impact, right? So look at this. Where do you want to land, and what does that mean? So I started off with our journey and then built upon that with Chocolate Milk Cafe. Next thing I know, the Mojamia Collective happened. Right now, in this very moment, I am building out an urban perinatal education center, trying to get a building, writing grants, doing all the things necessary to create that safe space based off of everything that I've done. And my ultimate goal, build a liberated roots birth center, because we need a space to deliver, you know, for us, by us, with us, alongside us, those who are intentional on making sure that Black bodies are staying safe. And so did I see myself getting here? No, but as the trajectory started to change, I adapted. That's why pivoting and planning is so important in what you do, even if it's just piles and piles of notebooks that you have. Stay true to it, visit it every single year. I mean, this is your business plan, this is your dream. You want to keep on making sure that you are checking the boxes and making sure you're going along so that you can reach your goal and not getting distracted by a lot of things that come your way. Next slide, please. If I talk too fast, please let me know. Our work is political. If someone would have told me that doulas would have had to like fight at the State House and meet with legislators and representatives, I would have been like, yeah, doula work ain't for me. But here I am, right? This is where I'm at. In the state of Rhode Island, we have a Rhode Island state bill. Our bill is Medicaid and employer-based. Why? Because Black women who are college educated, who have good paying jobs, are still dying in hospitals due to structural and institutional racism. And so our bill is built off that. If you're not at the table, you're on the menu. You need to read the bills in your state. You need to find out where these people are. You need to show up. You need to amplify your voice, participate, because at the end of the day, whatever they decide is going to directly affect you. And maybe all you need to do is listen, right? You might not have the answers. You might not know what's really being said, but you still want to make it that you're informed. When the hearings are coming, when the petitions are going in your community, you want to sit back and say, what do I know about this? What do I understand this? If I don't understand it, is there a number? Is there an email, someone I could call who can explain it to me? Because I want to still be a good advocate in this work. I want to be a good steward of participating in this movement. And part of that is making sure that you're aware of what's happening around you. You might not do anything but sign the postcards or make a couple calls to your reps, but that is something, and it makes a difference. Next slide, please.
Mrs. Osorio, we have about like 3 minutes for questions if you want to jump into that.
Yes, I think is the last slide like contact me or something, or we could just skip over it.
Yeah.
There you go. Look at right on
Great.
time. All right, 3 minutes. Give me these questions.
Okay, we thankfully had a lot of people answering the questions in the chat,
Woo!
but
Shout
I'll
out to
read I'll read a few. One says that for someone that already works a different job full-time, do you think it would be possible to offer doula services part-time?
So what I will say to you is take a look at what is your support look like, right? Is your job going to allow you to leave if your client goes into labor? Like, do you have a good flex schedule? Secondly, your support base at home. How does your family feel about this decision? And that includes your children, right? Like I asked my kids, like, is it okay if mommy becomes a doula? And I had to tell them what a doula is, but more importantly, how that's going to impact their lives. Sometimes I don't make it for birthdays. Sometimes I don't make it for celebrations. Evangeline's 3rd birthday, I was in Brooklyn, New York training, and it broke my heart to kiss my daughter and get on a train to go. But I did what I needed to do at the time in order to accomplish where I got to. But again, I'm talking to my children about everything I'm doing. My kids can give you a full-blown presentation on what I do. So look at your support structures that you have.
Amazing. Another question, what advice do you give for how new doulas can build agency in relationships, such as FaceTime, email, community introductions?
So I'm always going to tell you, like right now in COVID, it's very difficult, but you need to be in your community. People need to know who you are. People need to know what it is that you're doing. Again, attending any type of events that's happening in your community, showing up. If they're having like a backpack giveaway, put your brand on your shirt and go out there and support the community. Throw out a couple flyers out on the car. You know, just as I know, you go to the grocery store, you come out, there's a flyer on your windshield. Become a windshield flyer person. Let people know who you are, what you're out there doing. And then again, add that onto your social media platform and start teaching some of these classes. It doesn't take a lot of time to give a presentation on who you are, what you're doing, and why you're doing it. And then let those relationships naturally happen. You want it to be organic. You want it to flow. You don't want to fight this. This work it's not hard. It will come naturally to you if everything is aligned and your intentions are good.
Awesome. Thank you so much.
You're so very welcome.
Phenomenal session. We do have more questions, but questions that are not addressed will be transferred onto a community board where you can address them later. Thank you guys so much.
I'll see you on the board.
And you all can be transitioned to the next session.
Really quickly, could you share your social media handle?
So our journey on Instagram, our journey on Facebook, journey on Twitter. I think that's it. I think that's all I'm on. And you can find me on LinkedIn professionally. I'm not really on there all the time, but I'll say hey.
Do you want me to share your stay in touch form again?
Yes, please. Email me, call me, text me.
Do that really quickly.
Hey, Tisha, what's up? Shout out to Mojineer crew. Ready, set, latch, go. Letitia Mitchell over here in Rhode Island. Shout out to all the crew. I love everybody who sent me so much love in the chat. Thank you guys so much.
All right. Thank you all so much. You can transition to the next session. Have a great day.
Bye.